So I did my usual shift yesterday in the emergency eye clinic, and there's a certain subset of patients who think I'm some sort of genius when I'm not, because I normally know the diagnosis before I've even examined them. And that's normally by asking a simple question: do you wear contact lenses? Now, these people who do wear contact lenses are normally young, otherwise fit and well, and they're normally doing busy jobs and have busy lives. They typically wake up one morning and they've got an extremely painful eye that's come on very quickly. They've probably got quite blurred vision and they feel like there's something sticking in their eye constantly. They're often very, very photophobic, meaning they hate looking at bright lights, and they'll come into the clinic with their sunglasses on quite frequently. So what's happening? It's basically an infection on the surface of the eye. The contact lens that they've been using, be it a daily disposable or one of these ones that the patient has to take out every day and wash themselves, has caused a problem on the surface of the eye known as the cornea. The cornea is the glassy dome at the front of the eye where the patient sticks their contact lens, and it has a very thin and reasonably delicate barrier over the top of it known as the corneal epithelium. When patients have been wearing contact lenses, this can sometimes cause microscopic rips in the corneal epithelium, added into the fact that when a patient is blinking over their contact lens, they're not getting this repair mechanism that normally occurs in people who don't wear contact lenses, where tears are constantly being wiped across the surface of the cornea, helping to keep it maintained healthily. So a bacteria might get into a microscopic rip in the epithelium. And because it's sitting there with this contact lens over the top of it for hours during the day, the bacteria just take hold and they start growing colonies on the surface of the eye. And these turn into something that we call a corneal ulcer. So when I look at the patients with a microscope that we call a slit lamp, I can normally see a little white circular spot on the surface of the eye. And when I put some dye into the eye known as fluorescein, the fluorescein is taken up by this little white spot, and when I put a blue light on, it glows bright green. And I have to tell the patient that unfortunately they've got an infection on the surface of their eye as a consequence of wearing contact lenses. So what do we do? Well, first thing is that most of the time this is treatable and the eye recovers with no consequences. Very occasionally, if the patient has got a very big, severe corneal ulcer and it just so happens that it's growing over the center of the cornea, it can obscure the pupil, and if that leaves a scar behind, it can permanently cause problems with the vision, but that's extremely unlikely. Tell the patient to obviously keep the contact lens out, and the patient has to be told not to wear contact lenses until told that it's safe to do so. The treatment is normally antibiotic drops. You have to put them in quite frequently at the beginning. And the ulcer slowly gets better over the coming few days. The discomfort gets better within the few days, but you have to tell the patient to persist with the antibiotics until we normally review them again to make sure that it's getting better. So basically, these patients that come, it's extremely common, and it's basically my job is pattern recognition. But because I see these patients so frequently, I can almost tell what the diagnosis is as soon as the patient walks in the door, or simply by reading the referral that I've received from an optician or their GP. Contact lenses, don't get me wrong, they're extremely safe and millions of people are wearing them every day and never have a problem, even if they've been using them for years. But there are some things that can increase the risk of you getting a corneal ulcer if you are a contact lens wearer. And that's wearing them for an extended period of time, putting them in first thing in the morning when you get up and taking them out only before you go to bed, or even worse than that, forgetting to take them out and sleeping in them. Having poor hygiene, i.e. not washing your hands properly when you put them in or take them out. And if you're wearing reusable contact lenses, not looking after them properly with the correct sterile casing, and cleaning solutions. Washing your contact lenses under tap water is a big no-no because there are single-celled organisms known as acanthamoeba that can live in still water, fresh water, should I say, that can cause severe infections in the eye. So swimming in contact lenses is also something that should never be done. Most patients recover fully from a week's worth of antibiotic drops with no long-lasting problems. So it's all about educating patients about the habits that they are adopting with their contact lenses. And if these patients are coming back regularly every couple of months and it's the same patient coming back and getting recurrent corneal ulcers, I might have a conversation about whether it is a good idea for them to continue to wear contact lenses and whether or not it would be safer for them to wear a pair of glasses.